Hi, this is Dr. Eric, reminding you to check the link below to get your copy of the PDF that accompanies this Masterclass video. Thanks. Dr. Eric, True North Chiropractic, and today we're talking about low back pain. Lower back pain, what is it? It's very, very common. 8 out of 10 people will have lower back pain at some point in their lifetime, and it doesn't have to be crippling, I'm crawling on the floor painful. It can be, hey, you know what, I was playing flag football with the guys the other day, I woke up and my back's a little bit wrenched, right? So most of us will experience lower back pain at some point. Typically, the way that we injure our lower back is injury to the muscle tissue, which we call a sprain. You can also have a ligament issue as well, which is a strain. Those typically take a little bit longer to heal, and you can also have a disc problem as well. So those are the ones that are a little bit more serious, and we'll be talking about that a little bit later on. Other ways that we can injure our lower back is through a repetitive event, bending, reaching, twisting. If you're someone who's in a labor force, or if you're someone who's sitting at a desk for long periods of time, that's repetitive in the fact that you're actually sitting in a position for long periods of time. Or you can have a singular event. So this could be the case where you're picking up a case of water from the trunk of your car, or you know, something is about to fall and you go and grab it and you kind of tweak your lower back. So that's an example of a singular traumatic event. Another thing that we see too with lower back cases is, you know, people are doing too much. It's overuse. You know, these are the people that are out there gardening for 4 or 5 hours a day in the hot sun. These are also the people that rake leaves in the fall for multiple hours a day, you know, consecutively. These are the people that choose to take a snow shovel and shovel the snow all day long without alternating right side and left side. So you're kind of building up these injuries, these accumulations, because your tissues are not strong enough to do the work volume. So you're asking your body to do what it cannot do. You would, for example, you wouldn't train for a marathon by running a mile today and 26.2 miles tomorrow. Your body simply cannot handle those loads, and often that's what we end up finding ourselves doing. And we say, I don't know, I have this pain, and that's one of the reasons why. Another thing that we look at as well is people that are doing too little. So these are our sedentary people. You know, they're just not big exercises. You know, they stretch, they go do some yoga, which is great, by the way, or they go for a light walk. And those are all nice ways therapeutically to burn some calories, to get blood flow and oxygen into the tissues. But in terms of actually strengthening the muscle tissues of your lower back, we're kind of missing the boat a little bit. And that's where corrective exercises come into play. And we'll talk about that a little bit later on. So what are the symptoms of lower back pain? Some of the symptoms of lower back pain, you can have pain that's localized. It can be localized to the left side of the body. It can be localized to the right side of the body. It can be central, which can affect both sides of the body. So you really can't pinpoint it, but you can say it's kind of right across the small of my back. Sometimes the lower back pain, if it goes on long enough, can actually creep up the spine and start to attack the thoracic spine, because the pain is starting to spread because your body just doesn't know what to do to contain it. So it says, here, look, you take care of it, and it starts to spread that pain. Sometimes it can also just stay local but become more painful and more unrelenting. Neurological pain, that's something that we take very seriously as chiropractors, because that means that something more sinister could be going on. We really have to make sure of what's going on before we start to treat. You know, it can start off as muscular pain. You say, well, it was a spasm, but now that spasm is a burn, and that burn is actually starting to go down my leg. And what this is indicative of potentially is you're putting damage on the nervous system, and the nerve itself is starting to struggle to function and to do its job. So these are the people that'll say, hey, look, I've got this tingling, I've got this numbness, I've got this muscle weakness. You know, I'm starting to feel like my legs are giving out, or one leg is starting to give out. So these are some small things that you want to pay attention to, and also to discuss with your chiropractor in terms of what's going on. Radiating pain, that's what we call a radiculopathy. And a radiculopathy is pain that can go completely down one leg or partially down one leg. It can do the opposite leg, or it can be both consecutively. Something that you want to pay attention to specifically is if you're starting to develop some bowel or bladder problems, you're having difficulty going to the bathroom, or you have extreme pain when you go to the bathroom. A cough or sneeze can actually bring you to your knees. These are some signs and symptoms that are indicative of quite significant lower back pain, and the potential for a consult with the ER. So hopefully you're not in that case if you're watching this video, but if you have had those symptoms in the past, these are things to bring up with your chiropractor, because they really need to know so that they can best help and to best treat you, as well as give you adequate strengthening exercises to best help you out. The typical life cycle of a lower back pain patient, I see this in my office all the time, and it's frustrating because it's so simple to fix. We just don't know how to get there. So my heart goes out to everybody who has lower back pain. I myself had low back pain in the past. It's one of the reasons why I became a chiropractor, but it's something that we see that it's so preventable. We just have to pay attention. So the typical life cycle of a lower back pain patient is, sometimes it can be once or twice a year. We talked about seasonal work such as shoveling, raking the leaves, and maybe doing some gardening, and those things start to become chronic. So what was once a seasonal thing now becomes a couple of times a month thing, or a once a week thing. Or, oh no, I can't do the laundry because it's going to hurt my lower back, so someone else in the house now has to do it. So typically these pains that were once acute now become chronic. They're kind of more like a day-to-day thing, and these people typically start to use an NSAID like a Tylenol or an Advil or an ibuprofen or an Aleve, but there's a saturation point, and what ends up happening is those medications stop working. So what do? If some is good, more must be better, but unfortunately that's not the case, and on most of the bottles it'll actually say maximum dosage, and of course, do we listen to those things? Of course not, because that's who we are. And the problem that you run with that is because the medication is, of such an intensity, you're not finding this stuff naturally in nature. It's compounded, it's synthetically created. And what ends up happening is there's a potency in there, and our livers especially, they start to work overtime, and you can potentially develop, massive liver concerns as you get older. So these are things to think about, especially if you're a chronic medication user in your 20s or your 30s or even your 40s. So typically what will happen is after you tried the NSAID route for usually a couple of weeks or a couple of months, right? Because that's what we do. We just say a pill for every ill. That's what we've been taught. So what ends up happening is once that no longer works, and your friend says, hey, look, you got to call my guy. So then you'll go to a chiropractor or you'll go to a physical therapist, and both of us can absolutely help you out. We both do great work. You'll do a round of care and you'll feel great. And then once we've helped to heal your body, we say, look, we've got you the best as we can. I need you to continue to do these exercises, these strengthening exercises, these corrective exercises, monitor your posture at work, make sure you're getting adequate sleep, all of the stuff that we all know inherently is good for our bodies. And what do? We take it, we throw it away, and we go back to business as usual, and then the pain cycle starts all over again. And then if this happens year in, year out, year in, year out, case after case after case, then what starts to happen is then you talk to your medical doctor, you say, look, I've tried all of the conservative approaches, I need something else. And then your medical doctor says, sure. So he takes out his prescription pad, he gives you, the flavor of the month, and then you use that for 6 to 8 weeks or whatever the dosage prescribes. Or you'll say, hey doc, it didn't work. You call him on the phone and you'll say, look, it didn't work, I need something else. So they'll go ahead and they'll give you a different script for something else, and then you'll run the gamut of those pills, possibly in increasing intensities. They'll order x-rays, they'll order MRIs, they'll verify that you've got something going on, potentially a disc bulge or herniation, and then eventually down the road you start to have a consult with an orthopedic surgeon. And that's when they say, hey, look, we need to do some surgery. Whether it's major, whether it's minor, if it's a fusion, a discectomy, things like that. But surgery, there's no guarantee of success, and it's a very, very invasive procedure. They're actually going in and they're taking something out of your body, right? So that's pretty serious stuff. And with surgery in our office, in my office, there's 3 outcomes with surgery. You get better, you get worse, or there's no change, right? And you still have to go through that process. So don't jump to the gun and go right to the end of the line with surgery. Start with conservative first. So when we're working with a patient, be patient, right? It's a very, very simple line, but it speaks volumes. We need you to put in the work, right? Us as chiropractors, us as physical therapists, us in the healthcare world who work in a conservative atmosphere, your body can heal itself. It knows what it needs to do, but you need to give it time, and you can't rush things. So if you want to go and run a 5K tomorrow, and I say you need to ice and rest and make sure that your lower back is protected, don't go and run, right? Because you're going to call me the next day and say, doc, I screwed up. I went for a run. I know I shouldn't have, but I really needed to. It was a beautiful day. And I'll say, well, I'm going to see you tomorrow, or I'm going to see you later in the week. So don't be that guy. Don't be that girl. Let the body do what it needs to do. Listen to all of us who have your best interest at heart, because we want you to get better so that you can do those wonderful things, those exercises. Self-care and tips, right? This is the meat and potatoes of this part of the video. Your posture, super, super, super important. How do you stand? How do you sit? How do you sit when you're working? How do you sit when you're playing? How do you stand when you're doing those things? When you bend and when you twist, are you using proper form? You just kind of quickly bend down, lifts up something that's way too heavy for you. You should be asking for 2 people to help, but you just kind of muscle it and put it up on the shelf. Those are things that are going to start to catch up to you. So really, really monitor how you do anything and everything. Exercise. What kind of exercise are you doing? Are you doing exercises that are strengthening your lower back, or are you just going to the gym and just kind of building big biceps, big chest? You know, you want the abs, the washboard abs. Everybody wants that, you know, especially when it's the summertime months. But just because you have a six-pack abs doesn't mean that you're impervious to back pain. Right? So the exercises that you're doing, you have to make sure that you're involving a strength component of doing that. So one of the things that I like to talk about to my athletes and to my non-athletes is when you go to the gym, you need to strengthen the muscle tissues that you cannot see in the mirror. So everything that I can see when I look in the mirror, you want to work the opposite of those muscle tissues. So you have to do a lot of pulling based exercises, and those are things that we talk about at length in our office. You know, stretching versus strengthening. It can be too much of a good thing for both. You know, I see people that stretch all day long and they have back pain. I see people that strengthen all day long and they have back pain. And they say, Doc, I've been doing so many strengthening exercises for my back, it's ridiculous. I feel like that's all I'm doing. And I say, well, you need to give those tissues a break because, you know, there is too much of a good thing that can actually happen. So you have to be selective when you're working out those tissues, and you really need to make sure that you're diversifying your routine. So don't just train your lower back all day long. Focus on the glutes for a couple of days. Do those hamstrings. Focus on your upper thoracic exercises. You know, throw in a couple of planks, you know, things like that, some core stability stuff. It's not all just about six-pack crunches. You know, that's old school. You know, what we want to do ultimately from a strength perspective and a corrective exercises perspective is we want to strengthen the muscle tissues that have become weak, right? And we want to stretch the muscle tissues that have become too tight. And what we do is we teach you this in a reproducible way so that you can walk into the gym or home gym, whatever you have, and you can actually work on those tissues and help them to get stronger faster. And you kind of chip away at it as you slowly get stronger, and then we can add more weight, more reps, more resistance in a safe and predictable manner so that you can feel better and do better and get stronger every week that goes by, as opposed to regressing and doing the opposite. Self-care tips continued, using ice and using heat. You know, don't be afraid to use ice. Don't be afraid to use heat. In our office, I recommend approximately 10 to 15 minutes on and taking the rest of the hour off, and you can repeat hourly as needed depending upon the severity of your pain. If you're someone who suffers from a chronic injury, a chronic lower back injury, you've had it for years, you're more or less safe to use a little bit of heat, right? But if it's an acute issue that just kind of came on out of the blue, even if it's a chronic injury for you, I always tell people to start with ice. Ice is nice. It's very hard to hurt yourself with ice. You can absolutely make your pain worse with heat, because heat, you know, if you think about chemistry class from when you were in the 9th grade, heat is a chemical accelerant, right? It speeds up a chemical reaction. So if I'm adding heat to something that's already inflamed, I'm actually promoting more blood flow and more oxygenation to the tissues, and that can actually sometimes overwhelm the tissues, and you can actually make your back pain worse. And we've all done this. We've all been out in the yard raking leaves, shoveling snow, tending the garden, and we sit down in the easy chair. You get a little cup of water, you put the heat pack on your lower back, you sit in the lazy boy, you're there for far too long, and then you go to stand up, and then you drop to one knee, and you're reaching for the ball of Advil, right? So that was the wrong move to take. You should start with ice, right? So that's just a friendly tip. The intensity of the ice and the intensity of the heat that you use. Don't make it too hot. Don't make it too cold. A lot of people, they feel like it's absolute. They got to jack up the heat, or they got to jack up the ice to the point where they feel like they're in Antarctica. Wrap a towel around the heat. Wrap a towel around the ice. Dose yourself as you need, right? Don't you know, go to the extremes all the way. My call to action: if you or somebody that you know has lower back pain and it's not getting any better, or they've tried their version of what they think is getting them better but they've kind of stalled out, give us a call. You know, we're available over the phone. I'm available you know, obviously in the office. That's when I do my best work, but I'm here to help you, right? I want you to feel better. I want you to feel and do better so that you can live your best life. So for the most part, you know, responsibility begins with you. I encourage you to you know, take stock of yourself. Is what you're doing making you better? Is what you're doing making you worse? And if you're getting worse and there's no change, that's when you need to reach out, and we're always here for you. Okay?